Okay, so we're going to talk about it's in some areas a somewhat controversial topic today, heavy metal toxicity and pretty much everything that has to do with it. Heavy metal toxicity, testing, treatment, response to care. I'm Dr. Martin Rutherford. We've been doing these hangouts for quite some time now. We're trying to hit timely topics. I'm a chiropractor for 36 years, but I am a certified functional medicine practitioner primarily at this point in time. That is the vast majority of my practice, and my partner is
Dr. Randall Gates, chiropractor, as well as a board-certified chiropractic neurologist.
And we have married the two disciplines of functional neurology, working with the brain and the nervous system to get it to start functioning normally again, as it controls everything, as most people understand. And functional medicine, which is a largely non-drug approach to the common problems that show up in people's office every day, diabetes and irritable bowel syndrome. But out of that, our practice has morphed into a chronic pain practice. And I would say chronic pain and chronic conditions such as fibromyalgia and peripheral neuropathy and chronic fatigue are probably 95% of our practice right now. We're just seeing a lot of interesting things coming as a result of that. We just had a great post-concussion case with a gentleman who has incontinence, to say the least. He had incontinence, and we're getting those types of cases that are starting to respond to what we do. So we have a pretty wide variety of cases that we've had a chance to observe and see what works. Well, as a result of that, one of the many areas that we've had to look into is the never-ending recurring conversation on heavy metals. And I must say, up until just recently, it was one of the places, it was one of the areas of what we did that now we don't, Dr. Gates and I personally don't do chelation. We have an integrated practice in which we have some doctors of osteopathy, some DOs that do chelation therapy and different types of chelation therapy on referral. So we are conversant with it. We have used it in a percentage of our patients very successfully, and yet we kind of had to dig through all of the urban myths out there, find out what was what. Is it safe? Is it not safe? Does it work? Does it not work? I personally have a lot of these issues, which is how I got into this. I personally have experienced fibromyalgia and peripheral neuropathy and chronic fatigue, celiac and Hashimoto's. For those of you who don't know what all that is, there's a lot of autoimmunity in there. And I went and got my Mercury fillings taken out of my mouth because I got a test and it said my Mercury was off the charts. That was going to be the proper thing. I was going to take it out. I was going to feel better. I had like 6 Mercury fillings taken out of my teeth, and I had no change. So I had that kind of like, okay, what's going on here? Is this stuff for real? Is it not for real? We're going to answer probably all of the questions that you have today, or very close to them. If we don't answer all your questions, you'll feel free to ask us or email us, and we'll try to answer them. So heavy metals. We'll start out with, now Dr. Gates has done the mass, as usual, has done the mass, meaning all of the research on this. I've done a little teeny bit of research for my own purposes. And so I'm going to be deferring to him quite a bit here, probably for virtually the whole thing. We'll start out with an overview of alternative versus allopathic considerations relative to heavy metal toxicity. Is it real? Is it not real? That type of thing.
Okay.
And
yeah,
wherever you want to start.
Well, and I was going to comment on you saying the mass amount of the research, and for this week's discussion, there was a lot of research that went into it. In fact, we were going to do this topic, I don't know, a month and a half ago.
Yeah.
And we pulled the plug on it because I put 4 hours into it at that point and still didn't feel
and the research
really comfortable presenting everything to you as the audience. So yeah, there's probably 8 to 10 hours that went into today's broadcast on my end, and I know Dr. Rutherford has more as well. So basically, this is a very contentious area, as you outlined. Extremely contentious. Yeah. is an area of vehement opinions regarding whether to chelate or whether not to chelate.
That's very typical of the alternative field, though. I know when we got into this, we had to delve out. There's the groups out there where everything's parasites and everything's candida and everything's. This supersedes all of those. There's like
really
passion
does.
on this for some reason. Like heavy metals. I mean, the lady that had me here yesterday, she's a Lyme patient, and oh my God, she's been everywhere and tried everything, and she's getting worse over the years, and she's looking for something that's going to help, and her whole thing was, as soon as I get done with the medications from our doctor, we got to check the heavy metals. Like it was like, okay, well, there's a lot more going on here than heavy metals, but so it's an interesting area, and
extremely.
We'll stop the intro and we'll let him get it.
Especially for those working with chronic pain and chronic neurologic disease. So basically the mainstream medical approach to heavy metals is that they definitely acknowledge that acute exposure to heavy metal can cause problems. And that is where most medical doctors encounter a heavy metal exposure, and they're not really that common anymore, thankfully. We have the cases of the wife who is poisoning the husband who's poisoning the wife with arsenic, and they develop acute arsenic poisoning. Or we have, the kids who are playing with a ball of mercury for 3 years, and they develop, mercury toxicity. Or we have, the guy who's working on batteries all day long, he develops a lead toxic neuropathy. That is how metals are approached in the medical allopathic diagnostic realm. However, then we have the alternative community who has observed what the symptoms can be, so to speak, with heavy metal exposure, and say, well, a lot of my patients come in with these symptoms. Could it be the heavy metals? Now, there are literature articles to cite that these heavy metals may poison the nervous system, they may poison the immune system, and may be part of this underlying autoimmune epidemic we've talked about so many times in our other broadcasts. Basically, 1 out of 6 individuals in this country have an autoimmune disease where their immune system is killing them. That's never supposed to happen, as a general rule. So in essence, now a lot of alternative practitioners, every patient who walks in their door, they're testing for heavy metals, and every patient is getting chelated. And there are a lot of arguments about that. We'll get into the nuances of that. But basically, that is the dichotomy between the alternative community and the medical community. And we'll talk about the testing. We'll kind of bring it all together. Why?
And the truth is somewhere between those two
are growing apart, not growing together.
And we're not, we're considered alternative by most of our patients, but we're really not. I mean, the amount of research that has gone on into what we do, and the fact that we have embraced and brought medical doctors into, I guess, the osteopathic community at this point in time, into what we do, and do occasionally utilize in certain conditions their services relative to even medication. I think we're not alternative. I think one day what we're part of an evolving situation will probably become the paradigm for chronic pain, because we get really good consistent results, and I mean, really in the end that's what matters. And so like I said, it's going to be somewhere between those two, because you have the medical community that's got a pretty narrow view, and we got a alternative community who has a lot of doctors who like to chelate everything, and for a lot of different reasons.
Right.
One of them being, it's a big money maker.
You said it.
So now I don't have to bite my tongue anymore. And the truth is somewhere between there, where you're going to find out that there are times when it is a very valuable tool, and you're going to find out that there are times when it's completely useless.
Wow. Yeah. Exactly.
They don't take 6 metal fillings for nothing. You do have to pay them to do that.
Right. I have a very dear family member who had 22 taken out.
Yeah.
So we can go into signs of heavy metal poisoning basically at this point. So heavy metal poisoning, it can vary from metal to metal, but lots of times patients will present with gastrointestinal distress. They'll be anemic, where they don't have enough red blood cells, so they may be fatigued. They can lots of times develop things like peripheral neuropathy, hand tremors. Peripheral neuropathy is where the nerves out in your hands or your feet start to die or dysfunction because the metals poison them. Those are the basic features of heavy metal poisoning, but it varies from metal to metal again.
Yeah, well, like I said beforehand, I mean, in really trying to become conversant with this, I mean, I read it, and virtually every symptom I've ever had
Right.
And it could become from heavy metal. So I went and got my mercury fillings taken out. And as I stated to you before we started doing this, I said it just seems like it could cause virtually any symptom you can walk into a doctor's
Basically, yeah. And I went through like the top 5, but as you said, there's like 50 potential symptoms.
Oh,
and then also chronic pain is one of them. Muscle stiffness, joint aches. As we've mentioned on other broadcasts, we have 120 million approximately chronic pain patients. That's almost half the adult population in this country. And so that is why a lot of alternative practitioners are saying, okay, well, you have chronic pain, so probably do the heavy metals. And they probably do get success in a certain number of cases with chelating. That's justifying why they keep doing it. But basically the signs, again, are peripheral nerve dysfunction, GI distress, fatigue, anemia, muscle stiffness, weakness, joint aches. Sound like you?
Yeah.
Yeah.
So I again, to go back to again, we're gonna make the point that there is a value for this. I was just going to ask you, like, what percentage of our patients actually would we chelate, or have we had referrals for chelation? Pretty small percentage.
Very small.
Pretty small percentage. When I got chelated. I got chelated too. I got chelated and had the metal taken out of my mouth, and I went through 30 chelations, and 4 hours apiece, and it was time labor intensive. It was time consuming. I had to be away from my practice. There was no change. However, I must say, I was sitting across from a gentleman who was there at the same time I was, and he had legs that were completely black when he got there, and they were talking about amputating them. By the time I was gone, he was still there. He was in like 50 of them, and his legs were probably 70% better. So so we're going to try to get into the details of who should and should not be doing chelation, and I think we'll head into that kind of like right now. So, like, do heavy metals cause nerve damage?
Yes.
That was my first initial understanding of heavy metals. If I had a nerve, even though it's going to cure your fibromyalgia, or it's going to help you with this, or it's going to help you with that. My understanding was that if you were getting neurological symptoms, if you were getting brain symptoms, it was affecting your brain or your nervous system, and you had a high heavy metal content, that was probably causing it, or at least contributing to it.
Mm-hmm. Absolutely. So yes, heavy metals do cause nerve damage. It's especially talked about relative to lead, arsenic, and mercury. Lead particularly causes weakness in the upper extremities. They talk about the guys who used to smelt the batteries, work with the batteries, and their wrists would get really weak because the lead damages the nerves that innervate the muscles. Mercury toxicity causes the muscles, especially in the lower legs, to get weak, as well as it can cause a tremor of the hands. So people hold out their arms and they look like this. Arsenic can basically cause a neuropathy as well. Arsenic is commonly found in clinical practice with poisonings. So basically, and a lot of the reports are with medical practitioners trying to poison somebody because they know that arsenic will do that. So it's kind of one of those mystery diagnosis type things. But then there is talk of chronic arsenic poisoning. It's talked about a lot in India with their well water. And a lot of people develop these bluish pigmentations on their skin, these things called Mies lines. They develop. There's some question of peripheral neuropathy, but yes, heavy metals do cause nerve damage, and it's talked about relative to, when nerves are growing, the mercury has been shown to affect how the nerve talks to other nerves, and that is also, we attached about 20 references to today's broadcast, and of course I have more. If you want them, I'll send them to you. But they talk about, there was a literature article discussing dentists, and dentists who have been in practice for, I don't know, it was 10 or 20 years, who have been dealing with mercury amalgams, were found to have a high rate of nerve damage compared to control subjects. So basically, they had signs of neuropathy, even though they didn't necessarily have blatant symptoms.
And they think it was for the mercury?
It was from the mercury, yeah.
Okay. So, so neurological damage is usually what I would look for. Like if somebody comes in here, like we had someone come in the other day and they had a high mercury content in their hair, and we'll talk about hair versus blood versus urine, but they didn't really have any neurological symptoms at all. So I kind of said maybe that's not going to be on the top of our list as far as what we're going to be looking for here. And so I think that's the large part of what my education was look for neurological symptoms, and if they have them, and they have the mercury, send them to somebody. I don't do chelation personally, so send them to somebody, get them chelated. And I must say, overall, I had pretty poor results of referring people for heavy metals who had hair analysis stuff. And so it was kind of gave me this foggy area in my education of how to help chronic pain patients. So neurologically, though, it can be an issue, and it is something that you might want to consider if you have neurological problems. What we do a lot of here, and again, this practice has essentially evolved on its own. We kind of started doing one thing. I started with fibromyalgia, and then we figured out that half of the fibromyalgia patients had peripheral neuropathy, so we started doing peripheral neuropathy, and then as a group we started realizing that all these people had thyroid problems. We started doing thyroid problems, and then we realized that they all had immune problems, so we started treating the immune system, and then we realized the immune system responded better if you went to the gut first, so we started becoming like conversing with the gut. I mean, this is how our practice developed. And in the end, boy, probably 90% of our practice or more is our immune patients.
Right.
So there's a lot of controversy out there on does heavy metal toxicity affect the immune system. So I feel we're kind of in a position to maybe give some data on that. Absolutely. So you want to share that with it?
Well, some of them, this was discussed in the literature relative to rheumatology back in the 90s, the early 2000s, where they were looking at lupus and rheumatoid arthritis being associated with heavy metals. Basically, in every rheumatology textbook, they'll say, when we're looking at the cause of rheumatoid arthritis, we know that it can be bacterial, viral, or metal, meaning a bacteria caused the immune system to get overreactive to the person's joints and cause that joint destruction, or a virus or a heavy metal exposure. And then they'll say period, and then they'll go into chapters about certain medications they're going to use to shut off the immune system so that the person's joints don't get attacked as much. We have to credit Dr. Vasquez for his book on integrative rheumatology, and he has proposed a theory, and this was being employed in functional medicine circles, but I think he's really conglomerated together, and he's done a lion's share of the research. But basically where he said, let's look at those causes, the bacterial, the virus, the heavy metal, as insinuating the immune system to attack that person. And so metals being one of them, that was discussed in the literature. There was some great studies out of like Brazil and the Amazon rainforest where people mine for gold, and they use a lot of mercury there, and they saw that a huge percentage of these miners had autoimmune problems. They had positive antibody tests, other tests more synonymous with lupus. And then they did detailed studies of other antibodies showing that they're making antibodies to glutathione. Glutathione is the body's most powerful antioxidant. We all make it. It helps to flush things like heavy metals and toxins out of our system. And so they found that these guys who were exposed to mercury, they had antibodies to glutathione. So not only were they burdened with mercury, but they couldn't get the mercury out of their system as well. And so it has been pretty definitively shown that these metals are associated with autoimmune dysfunction. It's just that in medical circles, they don't really know what to do with it. They say, yeah, it may be part of it. They also have seen that there's another study with, I think it was other miners, where they found that those exposed to mercury had a higher rate of lupus than others who weren't.
We just had this is kind of
and we can talk about, we probably shouldn't.
I can just say our first name.
Yes, that's true. I think that's okay.
So, I mean, this is a case where the gal came in. I don't know if you want to catalog the whole case, but this one where the chelation saved this gal's life, in my opinion. Okay, I'm not trying to pat us on the back because it was just.
And Dr. Nagui deserves.
I was just going to say it was one of our colleagues who recognized that this young lady, she came in, she had clearly she had every sign that a functional neurologist or a functional medicine doctor would see as a probable autoimmune problem. She'd been to some very, very large facilities in Utah, hospitals and research centers. She lost 60 pounds or something like that. She could barely walk. You couldn't touch her. You couldn't touch her abdomen. It was her gut was so severe and tender. She ached everywhere. This poor kid she was a Division I basketball player. For those of you who don't know what that means, Division I basketball player. She was a phenomenal athlete. Apparently quite a joker, and she just was just a shell of a human being when she came in. We're putting her through our protocols for immune problems, for an autoimmune problem, and she was getting better. She was gradually improving, gradually improving. Then one of our colleagues, that one of the osteopaths that I referred to, Dr. Negley, took a little further history, and we take a really thorough history. And he noted that her husband worked in the mines.
Right.
And then he was bringing these metals home, and she was washing his clothes.
And it's very well documented, not to interrupt, that the dust carries these metals if somebody's exposed to them, and that can be inhaled, and that can cause an exposure to.
And then his position was that created an antibody response.
Right.
In other words, an autoimmune response. It enhanced an autoimmune response, and that's what happened. And within a week after her first
she started improving.
chelation, there was a noticeable improvement.
And by the time of 6 weeks to 2 months, she became a different person. Now she is the person. Her mom will say, she won't admit this, but her mom will say she's pretty much the person she was long before we ever met her.
Yeah, she's put her weight back on. She's conducting classes and exercise and swimming pools. I mean, this gal was bedridden. She was bedridden, and so this is where we're going to try to take this. There are cases where heavy metals are significant factors, but you need to not go online and go, I have those symptoms. Oh, I should be doing. And I took a hair analysis test, and I have heavy metals, and I should go get the heavy metals out. There is a way to understand whether you should put the time and effort and finances into that type of a thing, into that type of a protocol, and we'll kind of go over that as we go on. So just to set the stage, where we've seen tremendous results in the appropriate cases when heavy metals were a part of the clinical picture of what was causing that person's unique symptoms. So if you have immune problems, if you have autoimmune problems, it's something worth considering, for sure. But there is a way to kind of determine whether you should be involved in getting that type of a procedure or not. So that probably would lead us to our next subject, which would be there's acute heavy metal toxicity versus chronic heavy metal toxicity. And we're kind of in the chronic world, you and I, versus the chronic world. Absolutely. The medical model is the acute world. We have 120 million chronic pain patients running around the country. Part of the reason is because the model of care that those patients are attending, which is the medical model, is really an acute care model. It's really a like a right now model. Okay, you have this symptom, let's give you this medication for that. Let's do this surgery. Let's okay, there's no cure for this, so let's give you medications to make you comfortable while you slowly live the rest of your life in a usually a chronic decline. It's a totally different model than chronic pain requires. And I'm suspecting, Dr. Gates, I'm suspecting that probably even holds true for acute versus chronic metal poisoning.
Absolutely.
Yeah. So why don't you go ahead into that, because I'm sure we have both types of listeners out there.
Right. Yeah. So there's the case of, I read a case last night. Is these two boys in Iran? They're playing with literally this chunk of mercury for 3 years, and they ultimately get really sick. They end up putting them in like a vacuum tube because they can exhale mercury, and that can be very dangerous to the nurses and the doctors. And so then they chelated them basically in that CDC type, level 4 BSL environment, which is basically like the suits you see on the movies, and
the hazmat suits.
Hazmat suits, yeah, exactly, and they did a lot better, and they improved, and they survived. That's the medical model to acute heavy metal poisoning. But with the chronic model, we're talking about, okay, how are we going to chelate these metals out? And there's, like, going back to what we talked about, there's a big discrepancy in opinion regarding the efficacy of doing these heavy metal cleanses for chronic pain patients. So basically, we probably should talk about the lab testing. I think we need to jump to that to really.
Okay, I think so. I think that's again, we do consultations before patients come in. I don't know how this is going to sound, but we don't accept all patients. But it's not like it's like we don't accept all patients because some people just really don't have the the right parameters to go through this type of a program. They may not have the right philosophy, or they might be on too many drugs, or they might be on the wrong drugs, or they might whatever, or that they may just have too many organ systems that have shut down, or so on and so forth. So we do these consultations, and a lot of things come up over and over and over again. The people who are have very attentive to the heavy metal field, it's again, there is this really passionate emotional thing versus blood. Oh, my blood said this. Oh, my hair said this, and my urine said this. And there are other areas in the alternative healthcare that are like that. But this is a testy one among even the doctors, the alternative doctors themselves. So Doug Gates is going to fill you in on those, and we'll see if he agrees with what I think. I'm sure I'll probably agree with what he thinks, but we've been doing this for a little bit. I hadn't had a lot of success in the past, back in the days when I was doing nutrition back in the 80s with the hair analysis. I thought it was very inconsistent, and I really just stopped doing it before I even stopped doing all nutrition, because at that point I didn't really like the tools that we have to use. So, so why don't you go ahead with the testing?
So basically, the medical model is the blood test, and some alternative practitioners use the blood test. The blood tests are only accurate if you're acutely poisoned, like we've been talking about. Somebody's trying to kill you, or you're playing with the ball of mercury.
And to go back to what you were saying, we didn't quite get to the medical versus the alternative, but what Dr. Gates was saying about those two boys with the mercury is medical model mercury, medical model heavy toxic metal is somebody who just tried to kill somebody.
Yeah.
It's somebody who has been playing with mercury for, it's not the subtleties of, oh, you have chronic joint pain, and you have insomnia, and you have fatigue, and you have brain memory loss, and you have short-term memory loss, and you can't find your words and all that type of stuff. That's kind of more the alternative thing.
Right.
Okay. Exactly. So just to maybe make that a little clearer if it needed to be.
And then some alternative practitioners are still using the hair test. The hair tests are almost never used medically. So then alternative practitioners will use the hair test.
I saw one last week.
And they pull out the hair and they look at how much heavy metals are in the hair, because supposedly if you have too much, you'll excrete it out in the hair. They do this for drug screens, just so you know. So people are taking illicit drugs. You can see those drugs in quantities in the hair sample. But there's a lot of debate about the hair sample validity for heavy metal testing, just because there's an argument that it's not being excreted into the hair, just like it's not in the bloodstream. And then the most common test used for alternative practitioners is the urine test. It's called a urine provocative test. And basically, you urinate into a bucket, then you take a chelating agent and you urinate into a bucket, and you see how much or how many metals come out. The alternative opinion on this is that there shouldn't be any metals in your system anyways. And they say that if metals are coming out, they need to be chelated out of you, because they may be posing a problem for your immune system, for your nervous system, for your chronic pain, fatigue, so on and so forth. The medical approach to this, and in the literature articles, I need to specify that they'll say, we just don't understand enough about this at this point. That's what they always will say. And basically their approach is, well, there have been studies that show people who basically have no symptoms have these heavy metals in their body as well, so they can't be clinically significant. I wouldn't necessarily disagree with that, because some people have problems with gluten and they still eat gluten and they're still relatively healthy, but other people have multiple issues going on with their immune system. They take gluten out of their diet and they feel really good, as an example. So that's where they get the impetus for saying these urine provocative tests are dangerous. There are many government agency websites saying, cautioning the public to not do these tests, because then you're going to be sold on getting chelated, and that may be dangerous, and people die every year. You may not
die from it.
Well, they use the scare tactics, saying that calcium can go too low, and if you're not aware, if you're not careful with what you're doing, that can happen. But anyways, so those are the two sides of the coin, basically, relative to the testing. And again, as Dr. Rutherford was discussing, metals is just one piece of the puzzle. I think what's really neat about our program, and I'm going to get on the soapbox, is that we have figured out an organized way to delineate what is likely causing the immune system to attack the individual. We have treated, I don't know how many thousands of patients, and evaluated how many thousands of patients for chronic pain and chronic neurological diseases. And in the process of doing so, we have come up with probabilities as to what the most likely probability is as to why someone has an autoimmune disease. So what is causing the autoimmune disease? We feel that we have a good way of figuring that out. And we start with a very basic principle, and then from there we start looking at viral infections, bacterial infections, and if the person's not responding at that point, then we do look at the heavy metals.
Let me just, I'm going to interrupt here because people come in and they're very, very focused on the testing, but I'm going to take it back 2 steps. Okay, we do a consultation, we get kind of a feel for the case. At that point, we're not looking at heavy metals or not heavy metals because we're just getting a feel for whether it's the type of case. And like I said before, heavy metals can cause virtually every symptom that a patient has that walks into this office.
Yes.
Then we do we do a history. And to go back to what Dr. Gates said when he says we've looked at everything, we used to have a 41-page history. And it looked at everything, okay? That's right, 41 pages. And people filled it out because they were sick and they wanted to get better. Over a period of time, that has morphed down into 17 pages because we have looked at everything. Again, I go back to when I said we have all of these different factions in the alternative world. It's all parasites. Oh, it's all chronic. It's all Epstein-Barr virus. It's all Candida. It's all heavy metals. So I mean, there's all of these factions, and we had to like dig through all of them to see what was right and what wasn't right, and so on and so forth. So we built that into a history that is virtually that document to me is almost like better than any type of a test, because it's so precise. By the time we're done, we usually have a pretty good idea what's going on. This is what you should be looking for in your doctors, okay? Because this is what it takes. And then the exam is where really the rubber meets the road.
Exactly.
You've done all of that. You now have a pretty good idea what you're looking for. Dr. Gates does the neurological exam. Frankly, usually by the time you're done, I will look at all the history. I'll do a general systems exam. If the thyroid needs to be checked, I'll check it. If the gut needs to be checked, cold feet, all those hands, I'll check it. But by the time we're done, we have a pretty good idea of like, okay, heavy metals are probably not a player here.
100%. And if it does look like a player, we see the specific signs that are associated with that. And I really like this book.
And then
go ahead.
do the testing.
I have 2 things.
And then we do the testing.
Right.
And the testing in our world, I want to make this point because everybody's out there, they're going to come in, I want to do the testing, I want to do the testing, I want to do the testing, because they're used to the testing creating the diagnosis. The history and the exam, and we're not diagnosing, we're looking at physiologies that's not working. It allows us to understand what the physiology is, and then our testing pinpoints what's causing that particular person's symptoms. Remember what I said before. I could get 10 people come in here with fibromyalgia, and one of them, their symptoms are going to be relative to heavy metals, because heavy metals can cause just about any symptom walks in here, but 9 of them aren't going to have any problem with heavy metals at all.
Exactly.
Now you get into the testing, which, by the way, we use the urine testing. I'm sure somebody must have thought, okay, what do you guys use?
Right. Okay.
But I wanted to draw that big picture.
That's beautiful, because there is the overlap between. We feel that the criticisms from the mainstream medical community are correct in part, and we feel that
on heavy metal testing,
the legitimacy of doing heavy metal chelation is correct as well in certain circumstances. So yeah, that's perfect. And going back to the case we talked about of the young gal who had this horrible pain disorder, she had an autoimmune disorder. We worked her through that protocol I was talking about, and she was better, but she wasn't where we wanted her to be.
But in the history, we didn't know that she had the heavy metal exposure.
We didn't, and so that's why I referred to Dr. Nagley, because he thinks outside the box.
So he picked it up in the history.
He picked it up. I got to give him credit. And then with the chelation, that was the difference in her life, frankly.
I think it saved her life. Not to be like, but I think she was dying.
I mean, every one of her doctors has said that.
Okay.
So because we treat so much peripheral neuropathy in this practice, and you're out there watching this on heavy metals, wondering, are heavy metals important to me? A large proportion of our practice is peripheral neuropathy. That's where people get numbness and tingling in their hands or their feet, or burning or weakness. And so, as Dr. Rutherford was saying, the exam is very significant, because there are going to be certain signs if you have a mercury toxicity peripheral neuropathy, or a lead toxicity peripheral neuropathy, or maybe you have fibromyalgia syndrome. It looks like you have a metal allergy. That's also something talked about in the literature. So just know that it can be figured out, and you need that type of diagnostic process and workup to take place, so that you don't necessarily spend tens of thousands of dollars on chelation when it wasn't necessarily the issue. Or if it is the issue, then you're spending your money in a good fashion.
And ours doesn't cost tens of thousands of dollars. That's another whole story.
Not ours, it's Dr. Nagley's, but yeah.
That's another whole story. The whole chelation industry, if you will. But,
that's a good way to say it.
Okay. So is that kind of our take?
That's kind of our take on it. I mean, that pretty well summarizes it. So in essence, if you are wondering if you have heavy metal toxicity and you have the signs and symptoms of heavy metal toxicity, you may have an autoimmune disorder, and the heavy metals may be causing your autoimmune disorder or your neurological disorder, and they may not. It may just be some other aspect of your immune system being dysregulated, and that may be coming from a bacteria or virus or whatever cause. But for you out there, what you need to know is that you need to be very conscientious if you're going to get testing for heavy metals, and you need to be taken through a very good diagnostic workup to really make sure that is what is causing your symptoms. That's basically what I would say.
Yeah, especially if you're going somewhere and they're going to just say, well, you know, you got the symptoms, we need to do chelation, it's going to be 10, 20, 30 grand. Okay, it doesn't need to be like that. It doesn't need to be that much. But it's amazing to me how many people do that because they're desperate and they'll go spend that type of money. You need a good workup. You need a good workup by somebody who has your best intentions at heart and will be able to evaluate your need or not, and with a relative amount of certainty. So the alternative, I know that the internet's got its positives, but it certainly can be a negative when you start looking these things up and you start seeing all these symptoms. You go, oh my God, I've tried everything, I didn't try that, that must be what it is. I'm going here, okay, it's going to be 60 treatments at $120 a visit or something like that or more, and you're going to do it because you're like, man, I got to get rid of this stuff. There are ways to figure this out. And so just if you have any questions on that, feel free to contact us, feel free to email us. You will get an answer from Dr. Gates probably, and we'll do our best to help you out because this is an important subject. It's actually a subject of great passionate opinions in the alternative field for a variety of different reasons, and we hope that this presentation has been able to clear some of that stuff up for you. So until next time, you can contact us at powerhealthtalk.com with any emails or any questions you might have, and
or send them to our Facebook page.
Send them to our Facebook page, and we'll do our best to clear up anything we can clear up for you. So until next time, thank you for your interest, and we'll try to come up with another what we hope will be an interesting subject next week.
Thanks for watching.